Welcome to Module 2, Paving the Way for Successful CHW Integration. If you're viewing the modules in order, you should have a basic understanding of who CHWs are and what they do. The purpose here is to show how a CHW's responsibilities compare with others on a care team and what an organization can do to maximize the impact a CHW has on patient care. By the end of this module, you'll be able to understand the relationship between CHWs and other care team members, learn about the social determinants of health, gaps in healthcare and how CHWs can be used to bridge those gaps, describe general steps for successful CHW integration into care teams, and identify specific ways to integrate CHWs within your care team. Organizational experts say how important it is for employees to understand the roles of the people they work with and what they can expect from those whose responsibilities intersect with their own. This is especially important when bringing on a CHW, since the definition of that role is not as well known, despite the fact that CHWs have been around for decades working to bridge healthcare gaps. So let's look at some roles typically associated with healthcare practices and compare those to the definition of the CHW role. Here's how the United States Department of Labor, Bureau of Labor Statistics, defines three prominent care team roles. These descriptions are pretty broad in general. For our purposes here, they provide a reasonable picture of who does what. This should all be familiar. Note that if you'd like to dig deeper into these descriptions, you can click on Resources in the upper corner of the presentation window and download a Word document with links to the Department of Labor website. So now the question is, where does the community health worker fit? Before we answer that question, it's helpful to get a complete picture of the things that determine one's health. That will give you a sense not only of where CHWs plug into the overall picture, but also why their role is so important. Many factors determine someone's health. Note here that obtaining clinical care only accounts for about 10% of what determines health. Social and economic factors, the social determinants of health, play a more substantial role, accounting for 40% of all health determinants. Failure to address social determinants of health creates a huge gap in our healthcare system. So, what are the social determinants of health? The World Health Organization defines them as the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. Community health workers address the social determinants of health by going beyond the capacity of clinical care to address the non-clinical health needs and bridging the gap in healthcare. To enhance the picture of social determinants of health, think back to Module 1. Our community health worker, Gregory, was working to address the social determinants of health that were interfering with Kenya's ability to achieve good health outcomes. Gregory identified Kenya's concerns about walking in public with his medication and worked with his HIV specialist to provide alternative ways to take his medication. Gregory also addressed Kenya's food and housing challenges, and he helped Kenya overcome other day-to-day barriers that were affecting his health, including abusing alcohol and drugs. With that in mind, look at the summary of the CHW role that's been added here. It's based on the Community Health Worker Core Consensus Project. According to the 2016 project report, CHWs provide 10 core roles, including cultural mediation, culturally appropriate health education, coaching and social support, outreach, and individual assessments. Most importantly, CHWs solve problems and overcome barriers that fall outside of what common health providers do. The first point of note is that CHWs provide culturally relevant mediation and health education. This is why it's so important for CHWs to be or to have been a part of the communities they serve. Someone once asked, why community health workers specifically? What makes them different? The answer came back, anyone can read about what it means to go to bed hungry, but a community health worker in a low-income neighborhood has herself or himself gone to bed hungry. When CHWs are or have been members of the communities they serve, they and their clients share a common experience, language, and understanding. That commonality nurtures genuine trust. Remember how Kenya's trust level increased when he found out that Gregory had lived in his community. Also recall that Gregory's cultural bond impacted not only how he delivered services, but also how those services were received by his patient. Something else to note when comparing role definitions is where physicians, nurses, and social workers conduct their work. They typically spend the majority of their time inside a clinic or hospital. They rely on patients coming to them for help. As we saw in the first module, a major problem with the healthcare of at-risk populations is that, for a variety of reasons, many of those individuals will not go to clinics or hospitals. Therein lies a gap in the healthcare system. You can't treat people who don't participate in their own treatment plans. Oftentimes, the patient has other everyday priorities that take precedent over a treatment plan. Until they're properly addressed, it may be difficult to make any progress. Now, look at the CHW description, which was developed to bridge that gap in the healthcare system. To carry out the duties listed here, CHWs must be out and about with their patients. As cultural mediators, they assess individual needs within the context of their communities. Recall how Gregory accompanied Kenya to and from appointments, and how he used his position as an intermediary to solve problems that prevented Kenya from fully participating in his treatment plan. An effective CHW is not likely to be found hanging around the office. Implicit in this description is a requirement for very high levels of communication between the CHW and the rest of the team. In turn, the CHW is better equipped to contribute valuable patient information about their daily activities in the community that directly relate to their overall health. So, bridging gaps through the integration of community health workers into practices can have a positive impact on healthcare, and communication must be high for the integration to be successful. One may ask how a practice can accomplish those things as they bring CHWs on board. To make the integration process easier, the SIM CHW initiative compiled a list of steps to follow. The goal is to initiate a transformation process that results in satisfaction for both the care team and patients. To illustrate the progression of steps and the impact that each might have on a practice, we'll walk through a real-life example of an organization that transitioned the CHW role successfully. The story of Bronx Lebanon Hospital's Department of Family Medicine, known in the industry as A Bronx Tale, highlights best practices of integration as they transform their delivery of care by introducing CHWs to their care teams. This story began in 2007 when the chair of family medicine began to notice a consistent set of problems. For example, providers seeing patients with complex issues lacked time to diagnose and treat patients as well as they would have liked. This left little to no time for meaningful discussions with their patients or to provide important education about treatment options. In addition, many patients were not showing up for their appointments. Too often, this left providers unable to help patients reach long-term health improvements. The family medicine department of the hospital decided to utilize community health workers with their complex needs patients. Focusing on the 8 steps, let's take a closer look at how Bronx Lebanon Hospital integrated community health workers into their care teams and why they were successful. A key lesson learned in A Bronx Tale was how essential it is to have a CHW champion among the medical leadership. This individual should have access to processes that involve CHWs with enough authority to correct problems that may arise as teams get used to new people and processes. The next step is to create a supportive infrastructure, something that requires full commitment from key administrators. Going back to A Bronx Tale, we learned that the CHW program would have been impossible without the hospital administration's commitment to the CHW model. In that real-life scenario, one sees how Bronx Lebanon's administration accommodated the CHWs and supported the program. They provided a detailed job description that clearly outlined division of labor in the clinical setting. They also changed certain procedures to more fully include community health workers. Another important part of creating a supportive infrastructure is being very clear about expectations for individuals assuming the CHW role and for the rest of the team. Bronx Lebanon administrators established those expectations through the job description already mentioned. They also set expectations by developing recruitment criteria and a hiring process. Finally, to create a supportive infrastructure, organizations must hold community health workers accountable for making meaningful contributions and recognize those contributions. Administrators in A Bronx Tale tracked and evaluated CHW contributions so they could monitor the success of the integration. According to the story, the departmental chair's recognition of cost-effective contributions to patient outcomes was critical to garnering support for the CHWs within the care team and in the upper echelons of hospital management. The next step is to ensure that CHWs are respected. The administrators at Bronx Lebanon Hospital wanted the community health worker to be a full member of the medical team, not a secondary member who served on an as-needed basis or on referral. In this case, as integration became a reality, all members of the care team demonstrated appreciation for how the community health worker kept families connected and healthy. In time, this led to mutual understanding and respect for one another. Research has consistently shown that a CHW's success is directly tied to the support and supervision they receive within the organization. This is why Bronx Lebanon Hospital established a CHW supervisor role. The goal was to strengthen the communication and feedback from the community health workers. The supervisor, who served as an intermediary between CHWs and administrators, was able to provide CHWs with more focused, timely, and appropriate oversight, something considered vital to the program's success. Note that it's not enough to merely appoint someone to the supervisor role. Too often, the full impact of a CHW program is not realized because of poor or no supervision. An organization must commit to training the individual so ongoing supervision of community health workers is effective. Various entities have outlined a number of challenges CHW supervisors face and how to manage them. What follows is a list of challenges provided by MHP Salud, an organization that builds on community strengths to improve health for underserved Latinos through community health worker programs. The following challenges can be addressed through training. Lack of time to provide ongoing support. Lack of experience working with CHWs. Lack of training and preparation for the CHW supervisor. Lack of support for the CHW supervisor. Not knowing how to effectively provide appropriate support to community health workers. Incorporating technology into CHW supervision. Staying connected to the programs and communities being served. working with community health workers to overcome challenges that can affect their work, motivating CHWs, communicating effectively, collecting CHW data and completing paperwork, and ensuring the safety of community health workers. To overcome those challenges requires more than identifying the problems. One must address the skills required for success. Two experts in successful CHW integration, Joanne L. Callista and Carl Rush, have outlined the skills CHW supervisors will need to effectively overcome such challenges. These and other key skills should be the focus of ongoing training efforts. Organizational skills, for example, evaluating CHW services and assessing return on investment. Interpersonal skills such as mastering politics of identity, power, and privilege, historical and current discrimination, prejudice, racism, and stereotyping. Teaching and supportive skills, for instance, how to help community health workers overcome challenges that affect their work. Communication skills. Cultural humility and supervision of community health workers, something that may show up in handling cultural differences within the healthcare team. A very important part of successful integration is making sure that communication between the CHWs and the rest of the team flow easily in both directions. Community health workers must have access to read and document electronic medical records. Along with that, they must have the right tools to document activities. Community health workers should have formal and informal communication with individual care team members. That may be face-to-face, by phone, through email, or access to electronic medical records. To maintain solid communication, community health workers should attend departmental team meetings, staff meetings, and go on rounds. Beyond attending departmental team meetings, they should be given the opportunity to report out what they've learned. Finally, CHWs should receive interactive supervision, using the means for communicating that you see here. So let's look at several of these in a bit more detail. To reflect on the importance of accessing electronic medical records, we're going to step outside of the Bronx Tale for a moment and hear from Nadia Islam, an assistant professor in the Department of Population Health at the NYU School of Medicine. Her research focuses on developing culturally relevant community clinical linkage models. Emphasizing how important it is for CHWs to access medical records, Dr. Islam says, it's imperative for the CHWs to have access to the electronic health records. This facilitates bidirectional information sharing and CHW integration into the healthcare team. Through EHRs, CHW programs can track high-risk patients and report CHW intervention outcomes. For example, community care navigation community health workers meet with patients in the hospital to facilitate the transition to the medical home. This CHW team has access to the hospital electronic health records to allow communication of the outpatient follow-up plan with the discharging social work team. These community health workers also relay important medical information from a patient's hospital stay through documentation in the medical home electronic health record. Something else to emphasize from the list of communication channels is how important it is to attend departmental team meetings, staff meetings, and rounds. As appropriate, community health workers should report out to share what they learn when they're in the field. Acting as intermediaries, community health workers receive significant information that must be channeled back to the team. To be successful, organizations must ensure that care providers meet often to hear about issues that are impacting care when patients are outside of the hospital. To that end, community health workers at Bronx Lebanon Hospital participated in all departmental care team meetings. This enabled them to present detailed patient care narratives that focused on cultural, social, and communication issues. It was found that using this information and feedback, the care teams have been able to develop realistic and appropriate care management strategies. Okay, on to step 6. One can imagine how important it is for all members of a care team to understand how a new member of the team will fit into established operational models. At Bronx Lebanon Hospital, the administration took advantage of several opportunities to help clinical staff understand how community health workers were being integrated into the care team. Some of the ways in which they did this were continuing medical education courses, rounds with CHWs, team meetings, and staff meetings to maintain constant awareness of the roles and responsibilities associated with the community health worker position. This led to better integration of the community health workers and eliminated tension between the CHWs and other members of the team. Step 7 addresses the importance of including CHWs in planning. It should be clear from some of the stories that have been shared how important it is for CHWs to provide feedback as care teams plan for the physical and mental health of patients. This is key to eliminating potential social, economic, or cultural issues that could become barriers to health. Adjusting care plans on the basis of social determinants of health will often be the difference between success and failure. So, we've reached step 8. Here one observes how the frequency of meeting as a team impacts the integration of the community health worker. Moving back to A Bronx Tale, we find that weekly meetings paid significant dividends. Now that you've seen the steps required to successfully integrate a community health worker into a practice, it's important for you to start thinking about how you could integrate a CHW into your care team.